Sam was limping and he came in for a vet check, but he was also fearful, anxious, and stressed. So we asked his pet parents what causes his fear and anxiety and stress. They said, well, actually, the vet hospital. So we took him outside. Here you can see how happy he became. Here he's with his dad outside and his body language changed. And then we could go ahead and proceed with watching him walk, observing from a distance. Here you can see we watch him walk and we have a video and we slow it down to half speed because he was lame on the back left leg. And here you can see that he turns his back left leg inwards. And if you watch here in just a moment, he's going to hold his leg up. Watch for it. There you go. That is a sign that he has pain. He does not want to use that leg and it requires further investigation. We're here with Sam. Sam was just sedated because he is very anxious. We gave him an injection outside with his pet parents. You can see that he's sleepy, but he came to us because he's not wanting to use his back left leg. He is toe touching and it was impossible for us to evaluate him. So we sedated him so that we can do that. And we're going to use the PainTrace here because we suspect there might be something going on with his knee, but we want to see how he responds to manipulations. On Sam's exam, when he was walking outside, we noticed that he was toe touching on his left back leg, and this is something that raises a red flag for a torn ACL. We also noticed that from behind, actually his dad noticed that he had what he thought was a hole in his thigh, and it's actually muscle atrophy. His muscles have shrunk on the left thigh, which have caused the appearance of a hole, and in comparison to the right side, which has normal muscle, the left thigh has no muscle. So now we're going to feel this left knee, which is obviously loose, where there's a cranial drawer. If you take a look over here at the knee, when I move the long bones, you can see how easily they move. This is sign of a cranial drawer, which means he has ruptured the cranial cruciate ligament. So here you can see on the PainTrace the obvious yellow spikes. These are spikes that are associated with sharp pain, and it's obvious that this left knee is painful. We know this is painful, but now we've also proven it with our PainTrace. Here you can see the exact same peaks, those downward yellow peaks, which indicate narrow, sharp, and shooting pain. Here we can visualize when the cranial cruciate ligament ruptures, and then we can get our positive cranial drawer, which you just saw with Sam when he was sedated. This is very painful and requires attention. The surgeon makes measurements in preparation for the TPLO surgery. During the surgery, an injection called Nocita is given for 3 days of pain relief. Then we take the patient's blood and put it in a high-speed centrifuge to generate platelet-rich plasma. And here we can see the post-operative result with the TPLO plate in place. After surgery, we continue to help reduce pain, swelling, and inflammation when we use a FDA-approved Class 4 therapy laser seen here. This will help Sam feel better sooner than later, and that's always the goal. We want to reduce pain, we want to reduce swelling, and we want to get Sam back on his feet so he can build up his muscles again. Here you can see Sam after he's had his sutures taken out. He's happy. And next you'll see him walking out of the hospital. He is using his legs nicely and he is ready to get back to his normal routine.